Katz is an internationally recognized expert in pediatric gastroenterology and serves as the director of CHOC Children's Multidisciplinary Feeding Program. He's also quite charming and clever and tells some really good jokes. And I'm really happy to have him here tonight. So I know that all of you are excited too. I asked Dr. Katz if we could please talk about 4 different reasons that kids end up in intensive feeding therapy, but also thrive because of it. So although I think we could come up with a million different reasons, if we just focus in on 4, one of the ones that I've heard Dr. Katz talk about many times when I've heard him speak, and I also talk a lot about in all of my books, is that feeding is a developmental process. So Dr. Katz, I'm just going to let you lead with that. Can you talk a little bit about what it really means to follow a developmental process of feeding, and what the heck does that have to do with becoming an extreme picky eater?
First of all, Melanie, it's a pleasure talking with you today. I fondly remember our times together, and I hope for many more, should the situation allow it.
Yeah.
About a year ago, my daughter-in-law's sister sent around a picture of a newborn foal. She was at a ranch, and it was a pony that had just been born. I mean, there was still blood on it. And that pony, within minutes, was starting to walk around the corral. Well, when we're born, we're not walking around anywhere. And we're pretty helpless, if you think about it. And it's only over the time that we start to learn to roll, to become more able to lift our heads up, to have better body control. And then we start to crawl, and then we start to walk. And shortly after walking, we're running. But that is a developmental process. And everything we go through, a language, walking, motor, sensory, everything is based on prior experience and on a, if you will, a map of development. Much along those lines, feeding is a developmental process. You're not going to come out of the womb and be eating steak and potatoes. You're going to be starting, obviously, with breastfeeding or bottle feeding. But if something gets in the way, that process can be disrupted. A lot of the children that we see are premature or have had complex medical or surgical problems in the newborn period that forestalls development and leads to feeding problems. And many of those infants, those premature infants or newborns, remain in the hospital for a prolonged period of time just because they've recovered from the medical side of things, but they have to learn eating because their natural tendency have been disrupted by life-saving and important medical interventions.
Go ahead, please go ahead.
So when that happens, if a baby is born and has those medical interventions, it is critical that as soon as it is safe, that babies start to be worked with and trained to even suckle at the breast.
Absolutely. And I think that's one of the first things that I try to talk to parents especially about, because we all kind of assume that eating is just one of those easy things. You know, we have a baby and we're busy kind of counting fingers and toes and just making sure that all the parts are there, and not realizing that the baby's reflexes actually help them learn to eat. And as they begin to follow this developmental process, every stage builds on another stage, for sure. And so often I'll have a parent say to me that a very well-meaning pediatrician has just told them, you know, it's fine if she's on purees for the next couple of years. They'll grow out of it. And that just isn't the case. It's not okay for a baby to be on one stage of eating for too long, just like we wouldn't want a baby to be on a bottle only for a good 2 years without starting solids. So Do you run into that sometimes where you hear that a well-meaning pediatrician is just given some advice that perhaps maybe we need to support the parents in a little different way?
The most important short answer is yes. The most important advocate for the child is the parent, and the
Yes.
parent has to be heard. And if a parent is feeling, I mean, who knows the child better than the parent? If the parent is seeing that the child is not progressing as they expect the child to progress, they deserve the right and the privilege not to be told, oh, don't worry about it, they'll outgrow it, but to seek the help that maybe just slight, small, moderate, or even significant interventions might be needed. The earlier you get to a problem, the easier it is to solve. Not 100% of the time, but yes, all too often I hear that, and I think it's like a grinding of a chalk on a chalkboard when I hear that, because it's wrong.
Yeah.
You will not grow out of this if you do nothing. Nothing will lead to nothing.
Absolutely. The whole reason, I don't know if I've ever had a chance to talk to you about this, but the whole reason why I wrote, this is always hard for me, Raising a Healthy, Happy Eater with pediatrician Namali Fernando, and we go to the AAP and we pass that book out like free books for these pediatricians, because we really want them to understand this is developmental, just like learning to crawl, walk, run. And we wouldn't want to do anything to stall a child from learning to walk. So, or say, oh, he'll walk eventually. We would never do that. But feeding is the same thing. And the earlier that we are able to help these kids, sometimes it's just a matter of a quick assessment, a couple ideas, and come back and see me in a few months. But other times we get into a situation where, for a variety of reasons, the kids start to become more rigid over years about the way they're going to eat. And that's really driven by not only some behavior challenges, but by anxiety as well, and anxiety for the poor parents. Can you talk a little bit about some of the older kids, meaning like 2.5, roughly that age, that you and up, that you see in your intensive feeding program, and that inability to flex, where they really have to be rigid about the way they eat? Can you just chat a little bit about that and what you encounter?
You brought up a very, very important point. Before I get to that, it's this feeding issue oftentimes starts organically, but then becomes more behaviorally based, and you throw in the anxiety, and then you throw in the anxiety of the parent, and the parent then and the child develop this dance. If you imagine a couple dancing in a ballroom and how they
Yeah.
glide around on the dance floor, very rhythmically in sync, it's a beautiful thing to watch.
Yeah.
This situation is where the parent and the child are in this dance and they're stepping on each other's toes and they're going in different directions at different beats, and they don't have anybody guiding them.
Right.
So what you're asking for and what you're suggesting is they need that guidance. The children that we see oftentimes, as I said, started out with medical problems, not always, not 100% of the time, but we find that the child started with with a medical problem, with discomfort with eating, whether it's from significant vomiting issues or allergies or what have you. And they equated eating with pain, so they're resistant.
Yeah.
Then the parents who are struggling to get the child to eat will, if you will, stand on their left ear
Yeah.
to try to get that child to eat. And they develop disorganized approaches to the child. So feeding a child is not just the child, it's the relationship of the family who are sitting at the table with the child. It's the children then develop these rules, and a number of the children develop their own rules, rigidities. I only eat in this place, only this time, only this type of food, only this brand, only this temperature, only this color. We have kids on the white diet. We have kids on the crunchy diet. You have kids who will only eat McDonald's chicken nuggets, but will not eat chicken stars. They will check the package to make sure it's the brand they want. Now, the parents feed into it because they're desperate for the child to eat. Nutrition is important. Nutrition is part of love. If I am not properly supplying nutrition to my child, I'm not loving my child. I'm not being a good parent.
Feeding your child is all about nurturing and love and responsibility and everything we feel the moment they put that baby in your arms. And you realize that you're responsible for this child's ability to thrive for the rest of their life. And, you know, even now my kids are in their 30s, and what do I love to do more than anything? Feed them.
Exactly.
Yeah.
And much the same way, our most favorite time with our kids who are same age is sitting down at a meal.
Yeah.
And can you imagine the stress that it is for a parent to sit down at a meal and the child just turns their head or runs away or pitches a fit or gags or retches or just will not eat what you consider to be a healthy meal? It's very stressful.
It's very stressful. I was mentioning to you earlier that on my YouTube channel, and I'll be posting this there as well, I have a whole playlist to help pediatricians, to help parents even go and say, how do I talk to my pediatrician? And one of my favorite videos on there is with my co-author, Namali Fernando. And as you know, her patients call her Dr. Yum. I had no idea she was going to hop on today, but she's actually listening. I see she says hi to you and that this is a great discussion. But she's she is brilliant, and that she's so good at really detecting stress in a family, and she has some very creative ideas about how to actually take a video or a picture and keep an album on your phone of your 3-day food diary and reschedule another visit where you really have time to talk and try to figure out, is this something that perhaps she can offer a few ideas around? Well, she's very, very knowledgeable. Do we need to refer for feeding evaluation? Would a video swallow be appropriate? But I think one of the trickiest things for parents is that when they go in to see the doc, this is often mentioned during a well visit, or maybe the kid's got an ear infection, you know, and there just isn't that much time to really express, as you just said, how stressful this really is. I always say, stress that you're stressed. And so I'll be sure to include that playlist when I put this on YouTube as well. So that brings me to just the idea of an intensive feeding program, because I do intensive feeding here in Colorado, but I've also done, I don't know, over 15 years of early intervention and seeing kids once a week. And of course, they're all wonderful ways of helping children. But why do you think that when we have kids who've encountered those 3 reasons we talked about and more, that when they come to an intensive program, it can make the difference? Maybe they've tried some other things and they were great, but maybe the carryover isn't there. I don't know. Can you just talk to that a little bit about why you think intensives for some children really are the ticket to getting better?
When one commits to an intensive feeding program, you need the commitment of the child, but equally, if not more so, you need the commitment of the parent. Certainly in our intensive program, we have created a situation where everything that is involved in that child's life for that period of time has to do with feeding. Everything is about feeding. It is also critical that not only do we work with the child, but we work with the feeders, whether it's the parents or the caretakers, whoever is in this child's life, sitting at the table promoting the child to eat. Not everybody is going to be willingly happy to eat her kibble, as Sophie is, but it's our responsibility to train the trainers, if you will. And too often, the child goes for therapy and the parent sits in the lobby, and they are not given the opportunity to learn strategies. And like I said, we can work with the child. That's not often the biggest problem. It's getting the parents to continue. If there was only a way to magic wand this, to Harry Potter this, to click you on and the child would be
Yeah.
great and everybody would be happy, that'd be terrific. We'd all be out of a job, but that'd be great. I would love it. I could play with Sophie more than I otherwise do. But the truth of it is, if we work with the child and the child goes home and the parents don't follow through with those strategies, it's not going to stick. We see too much regression because the parents really are not equipped to handle all the tactics that the child's going to throw at him to avoid what they are being asked to do. By the time the children are 2.5, 3 years of age, when we ask them to change their eating, it's very scary.
Yeah,
They have
there's,
adapted a behavior pattern that to them, although we know it's dysfunctional, is very comfortable for them. And when we say change, it's not a happy experience for them. And then what makes it worse is when they see the parents changing their expectations, then they get really angry.
Mhm.
And very typically, ours is a 3-week program. We have what we call our second week behaviors, where the parents are now realized that they're no different than the therapists. The expectations that they are applying to the child is no different than what the therapists are asking me to do. Who is this woman? And what did you do with my loving mother? And you have to work your way through that. And by the third week, the kids, whether it's grim acceptance or they have found their way to the light, I don't know, but things then can progress. And then we empower the parents to continue the process once they leave our program and go home with close monitoring, of course, because
Yeah.
we're not done after 3 weeks.
No, no. I had no idea you were going to bring that up, and I'm just so glad you did, because I've been teaching a 4-hour course on ARFID, the anxious eater. It's a 4-hour masterclass. And one of the things I teach in that course is that what these kids do, whether they're 2 or 12 or 22, they stay in their safe zone because that anxiety drives that. That's what feels safe to them. And we all want to feel safe. Likewise, parents, because they are so scared, and I understand that, they also stay in their safe zone. But it's the right therapy that helps kids get a little bit broader safe zone, take another step out, and start to enlarge that circle of food acceptance. However, different factors come into play here. So the therapist will first establish the relationship and the expectations with the child. But if we don't pull that parent in as quickly as we possibly can, and frankly, fade ourselves out, even behind a mirror, talking to them through, headphones, and which I've seen in your clinic done so beautifully, where the parents ASAP are in there doing the therapy, kind of thrown into the hot seat. That's when we often see the kids really blow up and really have a big emotional reaction, because what the heck? We haven't been doing it this way our whole life. Like you said, who are you? What happened to my mom? And sometimes we have some big emotions around that from everyone. But once we can get through that and help that child feel safe and confident and trusting in the process, the parent will also do that. And then we start to see progress. And periodically, the kids will, as we know, we'll see that extinction burst where they suddenly have that burst of behavior again. And I always tell parents, when you see that happen, when things have been going so well, and suddenly the kid gives it that one last college try and he has a big tantrum or whatever it happens to be, he's just trying his best to go back to the old way of doing things. And you want to quietly, in your heart only, celebrate that, because that means it's going to get so much better really quick. It's his one last college try. It's going to be okay.
The
So,
key in that,
yes,
and what parents have to learn, I think most parents understand or at least know of the concept of timeout.
yes.
What they don't realize is it's as powerful if they put themselves in timeout.
Oh, yeah.
If you if a child is reacting as you have said, and we've seen it all. I mean, we could go down the litany of things that kids have tried to pull to get away from that that new way of eating in this situation, if the parent disassociates themselves from that event, what does a child want? They want their parents' love. And if you don't not love them, but you pull back, that's a powerful tool. It's not a weapon, it's a tool to engage the child, because the child is going to now look for other ways to achieve the parent's love and appreciation and approval. And I've watched some parents put themselves in timeout, and the child is going nuts in a safe way.
Sure.
And they have this grim acceptance. Oh, well, that didn't work. Maybe I should start listening to mom. Maybe I should start taking the French fry with some ketchup. Maybe it'll work. And then all of a sudden, mom comes back in. It's like, it did work.
Yeah.
So
Yeah.
that's what we work with.
I love that. I love that. And, just for everyone listening, I also want to explain that sometimes when a parent steps away, sometimes I'll have a parent leave the table for a minute, the child will get really upset because they've been looking to that parent all this time to rescue them from any sort of new food, not just being in feeding therapy, but this has been going on for a long time. Take this broccoli off my plate, and naturally you do because you want to have a peaceful dinner. But as you said, any way that the child's behavior around food, the child's relationship with food always 100% of the time influences the family and parents' relationship with food. And that in turn will change the way the parents parent because they're doing the best they can with the knowledge they have. And that in turn will begin to shift all of the family dynamics. And so part of what we do, especially in intensive feeding therapy, is start to create a different family dynamic that will work for the entire family so we can get back to joyful meal times. I was wondering if you would do me a favor and just tell everyone a little bit more about your multidisciplinary team and what you do there at CHOC Children's and why you're doing that. I can see that we're already getting questions for you. So for everyone here in the audience, be sure you're typing in a question for Dr. Katz or for me, and we'll pop them up here on the screen for the next few minutes. But Dr. Katz, tell them a little bit more about your wonderful program, and I'll see if I can't find us a good question to start with.
Our program's been in existence for about 15 years. And one of the things that I can clearly say is the program that we have now does not look anything like the program that we had 5 years ago, in that we are always looking to improve and we're always looking to get that edge. Our program is a 19-day in-house, in-hospital experience. It's unlike any other hospital experience in that no medical interventions are made. Everything is geared towards and keyed into feeding. We have 3 therapy meals per day, plus 2 or 3 additional meals that the parents do in their room to practice and to apply the strategies they're being taught. Our team is comprised of a dietitian, social work, psychologist, occupational therapist, speech therapist, and a medical component, which I am part of. We collectively, almost moment to moment, change our program as the child dictates. So we have a very active texting process that underlies the whole program, such that the therapy that occurs at one meal can change the next meal based on the child's needs. One thing that Melanie talked about is the use of video. We use video to not only monitor and look at each meal and the advantages that those who are not in the program, such as the father, if he's somewhere else, or a grandparent, or even a teacher or a therapist, they can watch the therapy meals and see how we are introducing new strategies. But also we do video of the parent and the child alone in their room, because that fly on the wall kind of aspect lets the parents see what they're doing, and they can actually critique their approaches to the child, not in real time, but subsequent. oh, yeah, I see I did that. I should
Yeah.
have done this. And it works so much better. And we came upon that and we use that routinely. Any tool we can use to further the growth of the child's relationship to food, that's what we try to do throughout the program. And what I like to say is we go from tears to tears. We start with tears of frustration to tears of joy. Not 100% of the time, but I would say the vast number of kids that go through the program are different when they leave the program. They still
Sure.
have,
Sure.
many of them still have work to do, but
Sure.
it's with our help they will continue that trip down the yellow brick road to the land of Oz.